In this research rundown, we're going to cover the NBIRR study. The NBIRR study is something familiar to the hyperbaric industry, clearly discussed for many years in the medical conferences. And to be more specific, it's the National Brain Injury Rescue and Rehabilitation Study. This is a multi-center study, and it overall included 32 patients. I've heard a lot about this study from Dr. Beckman, who was instrumental in pulling this study together. And one of his goals really was to get over some of these roadblocks that have been presented to the industry over the years, and going to the as I understand it, to the Walter Reed Medical Center. A former Navy or Army secretary, Marty Hoffman, said, "Hey, you need to get involved if you want to do something about this," and that's what he did. This was the culmination of the beginning of a group getting together and deciding to do that. And a couple of the, I think, important things about the NBIRR study was that it was not funded other than by individuals that helped put the study together, and it was really sort of this sweat equity study to try and get something that was a peer-reviewed research with the use of hyperbaric oxygen for this condition, for the brain injuries. And so knowing that, and actually taking the time to sit down and read the study, you're going to find that it's, of course, not surprising. It's very conclusive from the standpoint of that hyperbaric oxygen for brain injuries is both safe and effective. So it demonstrates the safety and efficacy of the therapy for brain injuries. So there is no funding, and so the study did not come out, and the research did not come out until 2019. I want to say that's almost 11 years from when this group of individuals first met, and hopefully we can get one of them, and I think Rob Beckman would be a good person to get in here to talk about this study, and so we get some background and understand it. Some of the important information coming out of the study, and it's like an 8 font, so it's kind of hard for me to read, was they did this ANAM mood scores. So ANAM is a test. It's a as far as I understand, it's multiple choice kind of test that is given to patients that are going through hyperbaric oxygen, and we compare the ANAM score before and after. And so a couple of the key indicators in the ANAM mood scores were sleeplessness, that decreases significantly, restlessness decreases significantly, depression, again, decreases, anger, fatigue, anxiety, all decrease significantly. There is an increase, not surprising, with happiness and vigor. And so, okay, is that subjective? Maybe it is to some extent, but when you take, and there's 32 individuals in this study, and you look at the average score, and you see half of the sort of the bad stuff happening reduced, by 50% or more, and then an increase in happiness and vigor, I'm signing up. And so then it looks at all these neurocognitive scores, and they are all going up significantly as well. So executive function is increasing, and someone's ability to function in society clearly improves by 50%. So that's a good reason to say hyperbaric oxygen does work. So let's just go to the summary here, and I'll read that briefly here. So here they're using 1.5 atmospheres. So we're at 1 at sea level. We're increasing that by 50%, and that's the protocol that they're using through this. And they're also using multiple centers, so it's repeatable in going to different places. It's not something that can only work at this one place. So there's no pride and ownership of where you get your treatments, as long as you're getting that protocol. And so the neurocognitive test scores of subjects improved in 21 of 25 users. So let's look at, since this is really focused on the veterans, and there is something out there called the CARES Act, which is intended to get more access to alternative therapies for veterans. There's a statement here I think that really holds true, and that the Act explicitly calls for the use of real world evidence, which is what this is. Oxygen certainly qualifies due to the Act. For example, the FDA now must consider patient experience. So that's sort of the new thing, right? And anecdotal data in its review process. The FDA might also expand its programs to expedite approval of breakthrough medical technologies for patients with life-threatening diseases and have limited treatment options. TBI certainly qualifies for that. And so it should be compelling, I think, with this is, of course, one of many studies, but this study was painstakingly done in a way that it's peer-reviewed. All of these issues or roadblocks that have been put in the way of many of the studies that have been done, because the qualification or the requirements for a study to be accepted, it seems to be a moving target. It keeps changing, and then depending on who's looking at studies, they might evaluate that differently. But in this case, it's clear patients are getting better with hyperbaric oxygen. We need to just stop this madness and get this out to as many veterans or anyone that's suffering from a brain injury as possible, because it's clearly a tremendous therapy that leads to a cure. So that's it.